we have taken this virus very seriously, and because of those efforts, we have the lowest numbers of COVID cases, both in terms of raw numbers and per capita. So we've earned, I think, the ability to try this and to do this with a reasonable amount of safety. So I just want to start with that because I know that there is some apprehension for people. In terms of specific things that might be helpful for parents, certainly for kids who have not had much experience using a mask, it would be great to start, make sure that they fit okay and that they're comfortable wearing it, and try to problem solve about that. Another thing that can be helpful in the few days before school starts is to bring back some of the routines that kids have had in terms of sleep-wake cycles, in terms of having regular meal times and things like that. And then if parents have not had the opportunity yet to do any kind of transitioning events to the school, you certainly could try to do some on your own, which could involve driving to the school, maybe sending an email or reaching out to the teacher in some way to get a personal response. All of those things I think can help for some kids and parents who are feeling a bit uneasy.
I think it's important to understand, sort of take our own pulse as parents. What are our worries and name them, and then kind of put them aside. Are you worried that if your child gets sick or if they get a fever, that they would get really sick? Would I get sick if I can't work? If we don't have money, we can't work. What are your worries, and then and sort of strategize around those. In terms of the child's worries, I think it's really important to meet that child where they are developmentally, trying not to project our worries onto them. So if they say, "Mom, what's a virus?" you can explain what a virus is, or "Dad, my friend's sick." Answer really the question that they do ask. In terms of trying not to fall into the pattern of being a nagging parent about, "Did you wear your mask? Did you wash your hands?" Sometimes when our children are with other children, either virtually or with family, I know many of us are sort of Facebooking with family or FaceTiming with family that aren't able to be here with us. School-age kids may be more likely to share with them more about their day than necessarily with parents, so asking them. Another tip that's kind of a fun game for dinner time, and I think dinner time and these routines of getting up in the morning and then having a closure touch point with family at dinner is really important. Talking with them about the high-low-high game. So what's the best thing or feeling that you had today, something you did that made someone smile, something else that made you feel good, and conversely, what was sort of a low point of the day. Those are ways to get a sense of what's happening, because I suspect there'll be moments like, such and such didn't wear a mask and this happened, or you'll be able to start conversations that way more organically.
Certainly, there's a whole range of opinions out there, and many parents have legitimate concerns in both directions. Some parents are worried that we're opening up too much. Some parents are worried that we're not opening up enough. And certainly there are a lot of legitimate concerns out there, but sort of similar to when you advise parents who are separated or divorced that you don't put your child in the middle of those conflicts and sort of use them as a sounding board. I might suggest the same advice here. So if you feel like the school's not doing the right thing, it's certainly appropriate to talk to the school and voice your opinion. But I would suggest not using your kid as the place where you're going to vent that, because I think it'll often undermine what the school is going to try to do and your child's ability to adapt. So if, for example, if you're someone who really doesn't think that masks are necessary and they're a waste of time, well, that's your opinion. But I think if you really voice that to your kid and that's a requirement at the school, you're kind of asking for trouble in terms of having your child take up the same view, and then that's going to probably create more problems down the road.
Part of the hybrid model too is allowing for flexibility and change that inevitably may need to come during a pandemic where many states have not been successful with going back to school. In our state, because of care for essential workers, we've had good experience already with children in childcare and after school programs and their ability to have kids safely be in programs. And now we're transitioning to school, and it's a whole new process of learning how to do this safely and well. And I think the key to this too is just is flexibility. You know, schools can reassess what the situation is perhaps, and many of us hope that school will be open more because developmentally it really is a good place for our kids to be if it can be done safely. There's really no wrong choice. I want families to understand that too. When parents say to me, you know, I've chosen to go remote entirely, or I have a hybrid model, or my kid with special needs needs 5 days a week, I respond with, you know, that must have been a difficult choice. It's good for you to come to a conclusion. What can I do to support your decision? You know, how will you reassess your choice? What will it look like if you change your mind or if things happen that way? It's not really black and white.
You know, if you want to have your child wear a mask, it's good to show them that you can wear a mask. If you want to demonstrate how important it is to have some social distancing, you need to demonstrate that yourself. So that's one. And the other thing was just communication, to be able to express, you know, this is why we're doing this, and then be able to answer any questions or, you know, hear what your child has to say and listen to their own views and opinions about it.
I mean, this is such an important question, especially in this time where we're sort of at a heightened awareness of issues of diversity, equity, and inclusion. But I do fear that this population of youth with neurodevelopmental differences might have their equity in jeopardy a bit. But typically when we approach these issues of access, if a system of education works for kids who may not learn in a typical way, remote learning really isn't for every brain. Typically when an accommodation is created for one child, more children have access, right? So the classic is like curb cuts in the sidewalks. They benefit more people than those who like use wheels to ambulate. So similarly, I've seen really nice creative classrooms that deliver in-person necessary services to access their education, like physical therapy and occupational therapy, something called applied behavioral analysis that helps kids with autism, all the developmental and social supports. And some of those creative ideas are having outdoor classrooms, having a dedicated routine time each day where a smaller group of children who need that specific service come into the school each day for an hour to have that service provided as they begin their in-person learning. There is one example of an IEP that included an in-person delivery of services outdoors at their home, or paraprofessionals that are typically for kids with needing support to access their education, being able to do that with a small number of children in person, masked, socially distanced.
Yes, screens. Well, I mean, I think even in the best of times, screens is probably, you know, one, if not the number one battleground between children and parents. And to me, this is an issue that, you know, really best probably requires a bit of moderation. I mean, parents only have so many options during these times, and I'm certainly not going to fault a parent for relaxing a little bit on the guidance and the limitations. But at the same time, I would also encourage parents not to throw in the towel completely and just, you know, give in to an entire day of, you know, zoning out in front of screens. So hopefully some kind of moderation is achievable. And, you know, one compromise parents could think about is not all screen time is created equal. So if you do need to give a little more screen time to allow, you know, you to get some work done, for example, well, maybe it could be something that clearly has a more of an educational content, or maybe it's actually, you know, an appointment or a, you know, a video with a grandparent where you're reading a book or something like that. So, you know, it's a little higher quality, but some sort of balance, I think, is what's called for here. And also, of course, to be finding some alternatives for screens. Some kids spend so much time in front of screens that they really don't know what to do outside of screens. And for those kids, parents sometimes need to do a little extra effort and suggest things, do things with them. That's, you know, obviously involves the parent really being there, but sometimes that's what it takes to get the ball rolling. What's complicated about the signs is that they're pretty non-specific. And so, you can mention things like kids who are more irritable or have a shorter fuse, or maybe having some new academic problems, or just seem kind of more standoffish. And that could be a sign that there's, emerging anxiety or depression, but it could also lead to from a lot of other things as well. So really, I think a good place to start is just to ask them, and not in an accusatory way, but to convey what you see and what you notice, and convey that you are concerned and you want to help, and give them the permission to ask for help, and then sit back and listen to what they have to say. For a lot of kids, that's going to help just all by itself. And for those that it doesn't, then you can start working up the chain, and you can start involving more people, whether that be the teacher or the school support staff or the primary care clinician, or even, an outside mental health professional if you get more and more concerned. But that's where I would start.
I might add, just conversely to that too, what we know that help adolescents especially, but young kids to do well, is having an opportunity to be generous, to have a sense of belonging, to be independent and responsible, and to have a sense of mastery, getting better and better at something. So if you look at your child's world and you say, they're following COVID rules because they want to protect their grandmother, that's a nice place they can be. They're being generous. They have a Minecraft gaming group that they feel like they belong to, or one good friend that they're Facebook, they're chatting with. And then lots of opportunities for our young people to be independent right now. There's whether that's with schoolwork or caring for a younger sibling at times, and having opportunities for responsibility, helping around the house. So this is an opportunity to see some of the things that we know help support young people too. And if they're missing, that's maybe where you can focus your energy. I think that sense of belonging right now is hard. When teams aren't necessarily able to participate, finding an alternative to that, focusing your energy on one of those areas may be helpful.
Yeah, I think that's a terrific point that Dr. Rinehart's raising for mental health in general. When people start to feel worse, I think there's a very natural tendency to draw inward and focus on more how I'm feeling and how I'm suffering. And that makes a lot of sense. But ironically, I think one of the ways that some people can get out of that is to have a more looking outward approach, and actually doing things to help serve other people. And they'll find that not only do other people feel better, but they themselves can often feel better as well. So I'm glad that you brought that up.
It all comes down again to routines, and the thing that school typically provides that we've been lacking is that getting up in the morning, having breakfast together, having a space for coming together at dinner, having an after dinner activity, and falling back into those routines is really helpful. Good nutrition is always important. We have a wonderful state where we have an opportunity to have farmers markets and access to really fresh, good food right now. And even food shelves have access to that as well. But boy, I can't say enough good things about exercise in terms of combating depression and anxiety, those natural endorphins. And of course, I'll let Dr. Rettew comment on that. But making that as part of your family routine as much as possible is very important.
Yeah, and I would add that certainly some degree of creativity and flexibility is often needed. If you've got a kid who always loves to do team sports, well, you may have to think of some other things. I know in our own household, we have discovered the wonderful world of disc golf, where we can go and walk around, and it doesn't cost anything, and we can distance ourselves pretty well. Not really something we did before, but we're trying to find some solutions in creative ways.
Hand washing is really enough. I think, I don't know, some people will come home and go from play clothes to hang out at home clothes, and that makes sense. But the virus itself is really going to be inhaled, and if they're wearing their masks and washing their hands, I think for the younger kids, there's going to be probably a lot of hands on the mask, which is not always the best strategy. So that coming in the door and washing your hands is really, really important. And we can set that precedent now, and have, I think, for the last many weeks as parents too, modeling that behavior.
My understanding that some schools are really encouraging washing the masks as well at very regular intervals, which sounds like a logical thing to do as well. And this is one of those places where I don't think it's really, it's good not to be extremely prescriptive here. There are a lot of moving parts, and each family has a different outlay in terms of their risk. And so I think we should, encourage families to really think deliberately about the risks and benefits of different activities, taking into account their own situations, and not for other people not to just assume that other people are being, making bad decisions or judging them too harshly. Because a family where, they're caring for an elderly grandparent in the household, or where there may be multiple siblings going to multiple different places, that's a very different situation than, where there's just one kid and two younger healthy parents. So a lot of moving parts, and so it's hard to just give a blanket answer to something like that, other than to really try to just think through these things.
Primarily a space that's just not their bed. I don't think people need to go out and buy ergonomic, desks and chairs. And, in my own home, I had an old door, and I put it on top of our filing cabinets and put a quilt on it. And I gave myself a little more workspace just because I needed more space. I do think that the access to internet in our state and Wi-Fi is a real issue, and families have to at sometimes take turns who's going to be doing what Zoom meeting when, based on the bandwidth, literally. And then also privacy for kids, both teenagers who just need time on their own. It's a natural thing. We all need that, but privacy for school and work. And if there's a small home and you can alternate a space that is sort of the Zoom space, that can often work as well.
Just a reminder that not only are we facing a real health challenge right now, but we're facing a real economic challenge for lots of families. And so I don't think the solution is necessarily to buy lots of expensive stuff that is not really needed. I think you can do a good job by just making some of the adjustments that Dr. Rinehart suggested.
I think we don't have enough kindness necessarily in the world right now, and so taking this as an opportunity to teach our kids how to support one another, to being a good neighbor, being a good steward of the public health rules. This is an opportunity of sorts that way, and know that we truly are all in this together. And don't forget your friendly neighborhood pediatrician too. We can be helpful for behavioral supports beyond just getting your immunizations, which are really important, especially with the vaccine this year. But yeah, so don't forget about us as a family team member.
I really like that, and I would just say that I think many of us have been really looking forward to this time. Both for the sake of our kids and being able to get back to learning and interacting with kids, and for many of us to get sort of back to our regular work lives as well. So I think, again, I want to say, like in the beginning, we've earned this, and I'm excited about trying, but it doesn't mean that we have to still take those measures to make this transition as safe as possible. We can't just say mission accomplished and immediately go back to the way things were and as we might like them to be.